The next domain is a ENT. ENT, medically would call that as an otorhinolaryngology. So when I am going to an ENT specialist, it would be technically a otorhinolaryngologist. So here we have an ENT exam and a general anesthesia, because we have the inner ear which is more towards the brain and that's connected with the nerve to the brain. So the exam is done under general anesthesia. You can report 92502. And binocular microscopy. So here with two eyes you can visualize. So that is a binocular microscopy. And nasopharyngoscopy with endoscope 92511. These are all pretty straightforward. Here with the nasopharyngoscope, sometimes the provider might see the layers of larynx to some extent, because we know pharynx, we have three parts, is oropharynx, nasopharynx and the laryngopharynx. So a part of the larynx examination would be an incidental finding. So for that, don't report a laryngoscopy. Okay, actually the purpose is to study the pharynx and the nasal structures. We have a variety of these ENT tests, like for speech disorders, for speech fluency, and for the resonance. And next coming is like a nystagmus. What is nystagmus? We say is dancing eyes, involuntary movement of the eyes. We call that as a nystagmus. There are three types as optokinetic. First thing would be like optokinetic, where when the patient is moving the eyes, at that time nystagmus sets in. Next is postural. With a specified posture, say if the patient is tilting the head or just bearing down, at that time the patient has nystagmus. That is positional nystagmus. Next is spontaneous nystagmus. It can be onset of any time. There is no specified activity. So here they are going to study the different types of nystagmus. Sometimes they do a calorimetric testing or caloric vestibular testing. What they do is like they pass liquids. One would be a cold water on one ear and a hot water on the other ear, and this might cause nystagmus.